Hi there, it's Tim, the exercise physiologist here at Executive Medicine. We all know that exercise is beneficial for heart health and particularly at reducing an individual's blood pressure. Well, today I'm going to go through a recent study that was published in the British Journal of Sports Medicine that looked at different types of exercises to see which one was the most effective at reducing an individual's blood pressure. So this was a meta-analysis where they looked at many randomized controlled trials to come up with overall conclusions about different types of exercises. They made sure they excluded any type of trial that had any dietary intervention, counselling, supplementation, any medication. So they were just trying to look at purely exercise and which one was the most effective. So let's have a look at what the study found. So they looked at 270 randomized controlled trials as part of the review, which included almost 16,000 participants. Any exercise intervention had to be at least 2 weeks in duration and had to be compared back to a control group. Now, the types of exercises they were looking at was aerobic exercises. So you think of like walking, cycling, and running. They looked at strength training. They looked at training that included both a combination of strength training and aerobic-based training. They also looked at high intensity interval training and also isometric exercises. So this would be like an isometric hand grip, an isometric leg extension, an isometric wall squat, but in a regular gym program, that could also be like a plank as well. So that's when you increase the tension and I guess contracting the muscles, but you're not increasing or decreasing the length of the muscles through a movement. So what did the study found? Well, the first thing to say is that all exercises were significant at reducing blood pressure, but there was some differences between different types of exercises. Now, the most effective type of exercise they found at reducing an individual's blood pressure was actually isometric exercises. And this is interesting because most of the common literature would, and I guess recommendations would be focusing on aerobic-based training. But when they looked at aerobic exercises, what was fascinating again was that this was significantly lower than the isometric exercises. But when they broke that training down between walking, cycling, and running, walking again was significantly less compared to cycling and running. So if you look at this graph here, this is a nice little chart they put into the study where they looked, you can clearly see here aerobic exercises followed by, high intensity interval training followed by aerobic exercises, then strength training, combined training, and then isometrics were the most effective at reducing systolic blood pressure. So that would be the top reading of your blood pressure reading on the machines. When they looked at diastolic blood pressure, that's the bottom reading. Again, high intensity in aerobic and combined training were very similar. Then resistance training, but again, the biggest significant improvements were seen with the isometric group. And interesting, when they looked at further information of the results, the reductions were even more significant in people who were in fact having high blood pressure readings at the start of their exercise interventions. So if you want to have a read this study, I encourage you to do so. It's not too long, it's quite an easy read, but it'll be included into the link at the top of this video. But if you need any more assistance with your exercise interventions, or if you need help with your managing your blood pressure, please come and see us, myself, or one of the doctors here. We're happy to help you with your treatment program. Okay, thank you, goodbye.